Hello, I'm Dr. Catherine Racowsky, President of the American Society for Reproductive Medicine. Thank you so much for joining us to review the most recent update of the ASRM COVID-19 Task Force document, update number 3, which was published last Friday, April the 24th. Before we do that, however, I would like to sincerely thank the members of the task force who have so generously given their time, expertise, and careful thought to provide guidance and recommendations for our members. As you may have seen, the task force is comprised of representatives from all 5 affiliate societies and includes reproductive endocrinologists, urologists, embryologists, an ethicist, an infectious disease specialist, an epidemiologist, the chair of our mental health professional group, and 2 patient representatives. I would also like to thank you, my fellow members, for your patience and your participation during these very challenging times. In the initial guidance of March the 17th and in the 2 subsequent updates, we were working in an environment of massive uncertainty and fear, which affected all of us one way or the other. During these early weeks of national lockdown, the task force thought it prudent and appropriate to recommend a pause in new treatment cycles, except for urgent procedures, including stimulation for cryopreservation in the setting of gonadotoxic therapies. Now we're starting to see a somewhat clearer path, which should mean the ability to cautiously resume care. So in the most recent update, update number 3, we map out recommendations for our path forward. The document provides guidance in 4 action steps. Firstly, when to resume care, and then the next 2 sections are on preparing to resume care, firstly with respect to risk assessment, and secondly regarding risk mitigation. And then finally, in the 4th section, we discuss resuming care. So firstly, let's discuss when to resume care. We stress that, and as we all know, governmental regulations dictate any decision to resume care. However, even when clinical activities are permitted by law, we recommended that practices remain flexible and consider the impact of their safely resuming operations on the local transmission rate and their community's risk and resources. We also recommended considering metrics and milestones as laid out by the federal government and its agencies, such as a sustained reduction in cases in their locales for at least 14 days and the ability of local hospitals to safely treat patients. We further recommended that we all stay up to date as new information emerges on this dreadful disease. And then finally, that practices ensure that they are adequately prepared to provide patient care safely with written policies and procedures in place specific to COVID-19 and to their own practice. So we provide relevant links for this purpose throughout the text, as we do relevant links for each of the other sections that I will be discussing. In the second step of our document, when to resume care with respect to risk assessment, we stress the importance of identifying, categorizing, and assessing predictable risks associated with each treatment procedure, and that these should be regularly reviewed and updated in view of the constantly evolving situation. We outlined that this risk assessment plan should be written and might include an assessment of who might be harmed and how, an evaluation of the actions that are currently being taken to control risks, a plan for further actions required to control the risks, a determination of who should carry out these actions, and a timeline for their implementation. Again, we provide several useful resource links in the text, including those to OSHA and to the CDC, to help you develop a formal documented risk assessment plan. In the 3rd step in the document, we outline when to resume care with respect to mitigation. As I mentioned, we recommend that practices should create written risk mitigation policies and procedures. These should be read, acknowledged, and followed by every staff member in your practice. These should cover healthcare and training of all staff, including use and wearing of PPE. We also suggest that practices develop educational materials for patients regarding COVID-19 mitigation strategies and also potential risks when pursuing care during this pandemic. In this 3rd section, we also discuss physical distancing, hand washing, and sanitizing procedures, practice pattern considerations, including approaches to help reduce transmission risk, and then very importantly, we also consider testing and documenting immunity. Although we recognize that testing would be desirable for all, as it is an important tool for minimizing viral transmission, we acknowledge that testing is currently not widely available. We further acknowledge that testing is currently recommended for all patients undergoing scheduled surgery who have the potential for intubation. Finally, we recommend that as testing becomes more widely available, that each practice should develop a testing strategy for patients and staff. Again, we provide useful links to up-to-date information in the document, and here I refer you particularly to the link to the FDA website, which is a particularly comprehensive and useful resource. The last section of the document discusses resuming care. In this section, we state that with the appropriate risk assessment, risk mitigation, consideration of resource availability, and thorough patient counseling, it is possible to resume reproductive services in an environment where COVID-19 exists. We suggest that decisions regarding prioritization of patient treatment is best done at a local level, with considerations including patient prognosis due to medical factors such, for example, as age, diminished ovarian reserve, the number of visits required by each patient. Obviously, the fewer the visits, the lower the risk of her contracting the virus or transmitting it. The impact of delay on patient mental and emotional well-being, and finally, the impact of delay on access to care due to insurance coverage or employment status. The SART website offers most useful information and strategies in these regards. You might wish to visit this website, and in fact, I would actually encourage you to do so. Finally, we recognize the importance of support and counseling, not just to patients, but also to staff during these unprecedented times, and we offer a link for access to a list of mental health professionals. So I hope you can appreciate that we've taken a measured and thoughtful approach, not only early, when there were so many uncertainties regarding this dreadful pandemic, but now in this most recent update, which I hope you will find useful as you prepare to resume care for your patients. Having said that, with recognition of the complexities and unknowns associated with this pandemic, we remain committed to providing updates, the next of which will be published by May the 11th. So in closing, I would just like to say again how extremely grateful I am to all of you for your patience, your understanding, and for your individual contributions during this unprecedented time. Thank you so much for listening, and I wish you, your families, your patients, and your staff all the very best. Thank you so much.